And as lawmakers consider how to fill the state's billion-dollar-plus budget hole, one idea that has been much talked about is an increase on the tax on cigarettes. Healthcare professionals are warning that without that proposed increase, Oklahoma could be facing a healthcare disaster.
Here we are again. Oklahoma's healthcare system is still on the verge of collapse, and the state's budget remains in a crisis.
Oklahoma Hospital Association President Craig Jones didn't pull any punches in describing the severity of the problems facing healthcare in Oklahoma. About 100 healthcare professionals were at the Capitol this week to lobby for a proposed $1.50 per pack cigarette tax increase. Jones says failure to pass the tax hike could mean up to a 14.5% cut in the appropriation to the Oklahoma Healthcare Authority. That, in turn, would translate into a 24.6% cut in Medicaid reimbursement rates.
Such a cut of almost 25% means that over a dozen hospitals across the state would have to close. And that's on top of the 4 that closed last year. 4 out of 5 hospitals across the state would no longer deliver babies.
Rick Wagner is an accountant with the Eide Bailly CPA firm, which works with medical professionals and rural hospitals, many of which are already teetering on the edge of shutting down. Wagner says 53 of the state's 65 rural hospitals operated at a loss last year, and 37 had less than 2 weeks' cash on hand to meet payroll.
I'm currently working with 7 hospitals in the state of Oklahoma right now that are living payroll to payroll. Every week we decide how we can make payroll this week. If they miss a Medicare or Medicaid payment, their ability to make payroll comes into question.
Wagner says 10 hospitals could conceivably close in the next 18 months as a result of the fiscal crisis.
Those will not be evenly dispersed across the state. There could be entire regions of the state left with no hospital and eventually no health care.
The problem is not limited to rural hospitals. Chuck Spicer is the CEO of the OU Medical System. He says once rural hospitals start closing, patients have no option but to seek treatment at more comprehensive hospitals like the OU Medical Center.
We continue to see patients that could not get simple pneumonia treated, have that pneumonia turn septic, and take up a room in OU Medical Center that we need for level 1 trauma, we need for complex cancer, and we're having to provide routine care because they cannot get it in their hometown.
The House Appropriations and Budget Committee approved a bill in February to hike the cigarette tax by $1.50 a pack, but that measure has stalled in the legislature. House Appropriations Chair Leslie Osborne believes the bill still has life.
My hope is that we will definitely push the cigarette tax. Not only is it philanthropic in that it shows from the American Cancer Society 26,000 young people will not start smoking, but it's delineated to only go to healthcare agencies that are bleeding.
The measure would need 76 votes to pass the House, meaning Democratic support would be necessary. House Minority Leader Scott Inman says they're willing to consider it, but only in return for consideration of other revenue-raising measures.
If they were willing to address the root causes of this financial crisis, gross production tax, income tax cuts, or even Medicaid expansion or Insure Oklahoma expansion, then our caucus would give all 26 of our votes to move the needle on cigarette taxes.
Jones says if lawmakers were to approve a $1.50 hike in the cigarette tax, it could generate up to $184 million annually.
That isn't going to fix the budget situation. That isn't going to fix health care. But it is absolutely the right thing to do for health care in Oklahoma.